Namaste. I'm Dr. Vishal Rao. I'm a surgical oncologist and also a part of the drug discovery team with Dr. Sreenivas and Dr. Ganesh as a part of the drug discovery team for Simataru, which is among one of the allo-polly herbals that we have invented for anti-cancer related properties of this drug. So today I'm going to be sharing with you some of the perspectives around the work we did on the aspects of cancer and what does the future of drug discovery in the area entail for cancer in general. Today, when we look at cancer, we are talking about a more inclusive approach towards integrated and complementary medicine. It's important to understand, like I told earlier, it is not about outsourcing your body to an oncologist, but it's also about insourcing and getting involved in a participatory way in your treatment. Now, why do I say so? Like I said earlier, cancer is about cancer cells and about the immune system. When you look at even stage 4, sometimes it's only 5% cancer cells, 95% good cells. But we forget to focus on the 95. We are busy with the 5. We are talking about killing, eliminating, but the 95 is still thriving there and looking for support. So today, integrated and complementary medicines and oncology are giving a lot of emphasis to understanding how could we work on both of them and how does the patient participate in this journey. It's very vital to understand this, that cancer treatments nowadays is not about just taking a medication, but also about structuring an entire program around your cancer, around your personality, which is what today we are talking about: personalized oncology and precision oncology. That means Dolo 500 milligrams may not be the same for everybody, as the same way that each individual genetics may be different. So in this particular approach, today it's very, very important for us to look at having a structured oncology program that provides you with a balance of looking at, while we are talking about the cell eliminations, we are also talking about activating the immune system, which is what we call the mind, body, soul medicine. We talk about IQ, EQ, SQ, the emotional quotient, the spiritual quotient are also equally important as much as that of the intelligent quotient. And this is where a patient's participation improves. Now in this structure, one of the most powerful bullets and the most unused bullet that I found was nutrition. Now when we talk about cancer, we talk about diet. And I told earlier that cancer cells live on sugar, they feed on sugar, and they try to look at a lot of faster metabolism. But the importance and the segregation between diet and nutrition should be very, very stark and clear. That diet is a part of the calorie intake that we done to routinely use and sustain our body for various activities. Whereas in cancer, which is a metabolic disease, a genetic disease, we need to switch the game. And that is where switching the metabolism talks about food as medicine. So please do not underestimate the power of using food as medicine. And there are structured programs that we could curate individually based on your palate, taste, based on the cancer, the stage, that needs to be curated to look at a balance between your nutrition. That is, you're looking at a balance of the carbohydrates complex, the proteins, the vitamins, the minerals, the fibers in a balanced way. And this is very, very crucial for every cancer patient to enroll themselves into a structured program which is beyond just telling about giving a medication, where there is an inclusive participation in healing, where the patient is talking about whether it is complementary medicine, integrated medicine, Ayurveda, or looking at yoga, meditation. Some people have talked about past life regression therapies, psychotherapies, hypnotherapies to be discussed with, or some others talking about basic techniques of yoga and others to be practiced. It's an integrated approach along with the 3 important triangles which I talk about. If your nutrition, if your water intake, and if your sugar cutoff is optimal, I think that's the important triangle that we focus on in an integrated and complementary approach.